Question that I get asked every now and then: what is the spit test for Candida? Is the spit test accurate for Candida? Does it work? Is it quackery? Is it a fraud? Is it a stupid test? Is it unscientific? Is it inaccurate? Is it bogus? These are all the sort of questions I get asked around the spit test. I can tell you now, I've been recommending the spit test for patients for over 20 years. And I don't think it's a bogus test at all. I think it's a very valid test. What I like about it, it's an instant test. So here's how you do it, and this is the way to do it properly. I've seen many YouTube clips and read many blog posts where people are getting inaccurate advice on how to do the test. So the way to do this test, when you get up in the morning, okay, you put nothing in your mouth before you do the test. So this is what I call a fasting test. So you have your meal at night, whatever it is. You brush your teeth, you go to bed, all the things that you normally do. When you wake up in the morning, before you put anything in your mouth at all, no coffee, no donuts, or whatever you have for breakfast, no cereal, no muesli, nothing. You just go straight to the kitchen, you get a glass of water, clean water. It doesn't matter whether it's tap water or whatever kind of water. I don't think it makes any difference. And you work up a bit of saliva in your mouth, and you spit that into the glass of water, and then you watch it. Okay, then you just put the glass down there on the bench top and you leave it there for up to an hour. And then what you'll notice, if you haven't got a yeast infection, or if you've got a very, very minor one or insignificant one, you'll notice that the saliva will float on top of the water. Okay, it'll just sit there. But what you'll notice if you've got a yeast infection, especially bad yeast infection, is you'll start getting strings hanging under the saliva, and they'll hang right down. Have you been to a cave and seen glowworms in a cave? You see all those little sort of things hanging off the cave. So it's a bit like that. It's a bit like you've got a level surface and something in suspension hanging underneath it. If you've got a very severe yeast infection, you might even find in the middle of the glass a cloud, almost like a little cloud. There could be specks in it. Or there could also be little specks or things on the bottom of the glass. Right? So these are things that may occur with a major yeast infection. Now, how does this occur? Why is this a valid test? Well, people who have got yeast infection, especially a moderate to severe yeast infection, they're attracted to sugar and sweet things. And what I find is many of the times these people will eat these foods and they'll start producing mucus in their mouth and saliva, extra saliva buildup. I've had this conversation with many people with severe Candida, and they'll say that they can eat a food and they'll have to clear their throat not long after, or they'll have mucus in their nose. And this will happen, this will build up as a consequence of the yeast, the Candida albicans in their mouth, on their tongue, inside their mouth. The yeast starts getting attracted to the sugar. It starts forming a mucus compound. So when you spit that in the water, you'll notice there's extra mucus there. It's quite large globules of mucus and phlegm or catarrh, whatever you want to call it. Many people with Candida have to clear their throat or clear their nose, the nasopharyngeal region. There'll be mucus in there. They wake up in the morning with a cough. Okay, the cough can be in the bronchial tubes. The cough can be, the mucus can be anywhere in this whole region here. They can be really phlegmed up. The esophagus can be really choked up with phlegm, with mucus. So people who eat sugar, crave sugar, will often have excess production of this mucus and a lot of saliva build-up in the mouth. And extra bacteria contribute in there as well, which are often the specks or the cloud. So you'll get Candida in the spit, you'll get in the mucus, you'll also get bacteria in there, and it'll form this whole big soothing oozing sort of a mess that hangs down off the water. So it is a valid test. I'd like you to do this weekly. In my book, Candida Crusher, I mention about the various different kinds of home tests you can do. With the spit test, it's good to do it every week for a 3-month period as you're going through the Candida Crusher program. And in my book, I don't know if I can show you, I've actually created a test tracker here. So a Candida test tracker. So what you can do there with the various tests that I recommend is you can actually write down a score of mild, moderate or severe for the test to track your progress. So in other videos, I'm going to talk about other kind of home tests you can do, like the craving test, the sound test, the smell test, the tongue test. There's various other tests. These are tests you may never have heard of, but I've developed some of these tests in clinical practice because I find they really work. But the spit test is a really good one you can use at home right now. So give it a go. Thanks for tuning in.